Hey everyone, so I'm Chaima. For those who don't know me, I'm an IMG working here in Australia. So to just give you a brief and quick introduction about myself, so I did my med school in Spain in 2023, and then I did my AMC1 in March 2024, got a job in and started working in Australia as an RMO in August 2024, and then also passed my AMC2 in November 2024. I also teach AMC1. So I'm just doing these videos because I got so many questions about how I did structure my CV to get a job in Australia that quickly. So I think the best way to answer that, because I'm not able to answer everyone, is to just do it together. So I have a template, which is the Tasmanian template, which I will share with you here below. So download the template and let's just make our CV together. And that will be the easiest way to explain how I did my CV. So I will just show you the same template I used to get the job and how did I fill my CV. So just give me 1 second and I'm gonna share that template with you. So that's the template. So I will make sure you download the template, stop the video now, make it open, and let's do it together. So first thing to do is in our CVs is always the heading. So the heading has to be a nice one. So you have to put your name and qualifications. So in my case would be Chaima and my surname and my qualification. So I just have an MBBS. So that would be. And then I put my address. If you are in Australia or you have an Australian address, that would be the best to do because that makes you a bit more visible in terms of application that you are already living in Australia. And then you can put an email, make sure it's a formal email, a nice email, and then a phone number. Again, if you have an Australian phone number, it's always better to put an Australian phone number. And then let's start with the most interesting and I think the most important part of your CV, which is the professional statement. So a professional statement is a summary of you and it has to stand out. It has to make the recruiter like really interested in hiring you. So you have to put all your best on it. It takes time. You have to think and you have to make it nice and make them, be interested on you. So how I would start this. So let's start together. So the way I would do it is, so we are all doctors or junior doctors. So if you're a junior doctor like me, so I would start like a junior doctor from, so wherever you're from. So in this case, I would put Spain. Sorry, guys. Yeah, so Spain. And then you say how many years of experience you have with X years of experience. If you don't have much experience and you don't want to put it as like on years of experience, so you can just say with wide clinical exposure to different medical/surgical skills, surgical departments. So yeah, depends. So I had only my internship experience, so I didn't put the years of experience. I just said I have a wide clinical exposure to different medical and surgical departments in Spain. I also had I had electives outside Spain, so I added those ones there because I thought it looks really nice to say that you have worked in other countries or you have done, observerships in other countries. But if you have a lot of years of experience, or even if you have 2 years of experience, it's really nice to put that. And you always have to say, if you have a specific field, so you can also say, I'm competent, I'm competent or competent in whatever field. So you say the field you have, or if you are not competent because you are still a junior, so you can say, interested and worked in several fields, and you say the fields you worked in. And that would be this quick introduction of you, like where are you from, how many years of experience, and where do you have like interest, where you have more exposure. Just don't make it sound overcomplicated. Just keep it simple to the point, but just show that you have exposure to, I don't know, whatever you have, it doesn't matter, to ED, to ICU, to cardiology, anything, to GP practice, to rural work, anything would matter. Just make it sound good and professional. Once you do this, the other thing I really think it's interesting to do is to say why you want to work in Australia, because we all want to work in Australia for a reason. So I'm interested in progressing my career in a highly advanced country, such Australia, as Australia or such Australia. Doesn't have to be same like me. Please do not copy and paste the same thing I do, because if, let's say, 100 people are watching this video, they are all going to put the same phrase and they're going to apply to the same jobs with the same phrase. And that does not really look nice to see that someone copied and pasted some information. So just say why you are interested in Australia, or what training are you interested to do in Australia, or if you have visited Australia before. So you can say, I have previously been in Australia and I have been since then very interested in how the health system works in Australia. So that will make you, unique as well. It tells them that you are aware of the healthcare in Australia, you visited Australia. If you have never been here, you can just say, I'm interested in Australia as it's a country for IMGs, and it gives them opportunity to grow and become great professionals. Something like that. Just a quick line. It doesn't have to be overcomplicated again, just to the point. And now you have to come here and say, what do you have at the moment? So I have passed my AMC 1, or another way to see it more fancy, which I like it more, is to say I'm eligible for limited registration. And if you are already in Australia, I have full working rights. And I'm aiming to pursue opportunities in RMO or HMO roles. And that would be. And then you can always finish it and end it in the best way I like. It's to say, what would be your future career aspirations? So I aim to pursue. So if you want, or I aim to enroll, or to apply to, I don't know, so basic physician training, which is BPT, which is all the medical subspecialty in BPT. So that also shows you that you are aware of the training pathways and what you want to do. If you want to apply to GP training, so you want to apply to GP training. In my case, I want to apply to the GP training after getting my general registration. So as you see, guys, it's a very concise, very professional, no fancy words, nothing. It's just more about showing yourself, showing your strength. I think one of my strengths were that I did my med school in Spain, but then I did some electives, which were as a medical student in UK and also in Norway, which that was unique in my CV. And then all the rest was very similar. I knew about HMO roles. I knew about what is a BPT. I know that I can get into that after my general registration. So that will be the main thing you want to have. I'm sure many of you will have much more experience than me and will be able to emphasize that in that statement. So make sure that, of course, if you are Australian citizen, make sure you mention that. Make sure you mention that you are an Australian citizen, because Australian citizens have more preference in getting a job by law. That's it. So once you've done that, you go with your qualifications. So my qualifications actually were just my MBBS. So that was a bachelor's degree in medicine. So yeah, bachelor's degree in medicine. I did it from my uni, your location, and which year you got it. So that was 2023. And then I don't need any of these, so I remove them. So I have seen people that if they don't fill the other cells, they keep them in the CV. So it doesn't look aesthetically nice. It looks like you don't have more qualification, and that's why they are empty. Just remove them. So make sure you remove them. So we delete the cells, and then they're not deleting. Sorry, guys. 1 second. Perfect. So you just keep it like that. It's not an issue. If you have only a bachelor's degree in medicine, that will be fine. I added here as well my AMC exams. Sorry, guys. Yeah, I just remembered that I also added, I have my AMC 1. So when I applied for the jobs, I only had my AMC 1. So AMC, MCQ, you just say Australian Medical Council. Medical Council. When did you do council? Where did you do your exam, and where did you do it? So mine was 2024. And that was it. You can add your English test as well if you want here as well. So you can do PTE. Again, where do you do it? So it'll be same PTE, and then the location where did you do it, and the year you obtained it. You can do it or not, put it or not put it, whatever you want. It's not mandatory to put it. So that would be. And then very important to have your medical registration. So I did have my registration in Spain. So you put, okay, so you put the date where you obtained it, the name of the authority, and then the country, and then the number of your registration. And again, you remove all the cells that you don't need after that. Perfect. So for now, we have our qualification. If you guys have a master degrees, if you guys have a specialty training, add that to your qualification list. I just did not have any, so that's why it's not in there. And then if you had previous registration more than the one that is in your country, because you worked in different countries, so you add that as well. And then we go quickly to the detailed practice in history. So something really, really important. Your CV has to be 2 pages, maximum 3 pages. The first page should include some of your work history because that's what they look at. So they look at your personal statement and they will go and look at your medical history, like practicing history, and they want to make sure you have been practicing. So that's very important. So if they see that you have your practicing history in the beginning, that makes them go through your CV as well. So you have to put, so you will put where are you working now, the current one. If you are not working, just delete the current one and just put the most recent one here. So you do the date. So I was working, for example, from, well, that's the reality. I was working from July to September 2023. And then what was the position? So it was HMO, RMO, whatever you want to call it. It's all the same. GMO, these are all the same. If you've been working in a higher position, so put that. If you were working as a consultant, as a registrar, and then full-time or part-time, so you can say full-time. And then you have to show your responsibilities. This is very important. So when we do our responsibilities, you don't have to give 1,000 responsibilities list. Just keep it concise and small. So first, what we do all as doctors. So examining, well, first we do taking history and performing physical examination. What we do, requesting investigation and discussing management plan with seniors. What else we do? I don't know, assisting in ward rounds and communicating with, health stuff. I don't know, you don't have to copy and paste similar as I did. This is very non-specific and general, so it has to be like this. It has to be just general things that you do. Make it better than this. This is a bit like very simple. Just make it 3-4 points maximum about what you do. And then if you have done anything like audits or things like that, so ensuring that medical practice under the standards, the desirable standards. Yeah, you just write it better than me, you paraphrase it better than me, but that's the idea. I'm just trying to show you the idea of how to do it. Literally, it does not have to be a list. It becomes overwhelming, not paragraphs. 3, 4, 5 sentences maximum. Just showing what you have done exactly, and then where hospital. And then you can put here hospital, city, and country. So that way, it saves us these 2 boxes, so we can delete them. So delete cells, and then we can delete entire row. And then, of course, once you do your CV, you have to remove this. So these things within brackets, you have to remove them. And then you say which facility and country, and then contact details. You can even give a phone number or an email. You can remove this other cell as well. And then let me see how I remove these delete cells. And then, yeah. So here I put my hospital number and that's it. So very easy, very quick, and it has to be within the first page. So if you see, our first page already has our professional statements, our qualifications, our registration, and also our first job, where are we working currently. And then you can always do, so we can, of course, delete this. So for every previous job you had, you can do the same thing. So date, title, responsibility, facility, and all the contact details. So for example, I only had this job, and previously I just had my internship. So I would say my internship was in 2022, 23. And then you put the position title. So that was intern. And then you say full-time. And then responsibilities, I did put rotations here. So I did put the rotations that I had. So I had gen surg, I had internal medicine, I had obs and gynae and peds, sorry. And then I did put responsibilities like this. And then similar, very similar to the previous one. So taking history, performing physical examination, requesting investigation, escalating cases to my seniors, making sure reviewing every acutely ill patient, doing cannulas, bloods. You can include wherever you want, but just keep it simple. Keep it simple in 3-4 lines, not more than that. You can do anything. You want to also say assisting during surgeries and assisting for in obs and gynae, assisting births and C-sections, and also assisting wherever you want to put, so you can do it as well. It just make it simple, because they're not going to read everything, you know. They just want us to put very simple points. So yeah, so for the internship, I would just use one box. And if you have done your internship in many facilities, you just put one of them here. So I did some of them in Spain, so I put my hospital here, but I did some of them in Norway. So that will be mine. And then the contact details, I just need one box for contact detail, and then I remove all the rest. Let me remove these. I don't know how to remove it now. I forgot. Yeah, one more. Oh no. So one second. I'm trying to remove it. Okay, yeah. Perfect. So this way, you will have, and of course, if you have more experience, just add more tables and make them there. So in this way, you almost covering half of your CV in a page and a quarter, or a page and a half. So up to here, that will be great. So what's the next thing to do is presentation, teaching, and audit. So if you have not done an audit, just remove the word audit and put presentation and teaching. So if you have done any presentation, so you just put the date 2023 and what did you have present. It doesn't have to be a national presentation. It's any presentation you have done, even in med school or even as a junior doctor, just as a, for example, most common arrhythmias in ED patients. If you have done a presentation about that, just do it. You don't need any certificates for this, anything that could help you. And then you can also say you have done informal teaching for medical students. Again, do not copy paste everything I write. Just may find another way to say the same thing I'm doing, right? So that's yeah. And then if you have done more teaching experience, just put it more in there. If you have a YouTube channel that you are teaching others, just put it there. If you have anything out of the box that you can think of, put it there. If you have done any volunteering experience, so you just can put teaching voluntary. And then you can add this one as well. So if you have volunteered as I don't know, helping in a hospital doing something, just put it there. Like I'm volunteering, like taking blood pressure. So I know one of the initiative that was there in my hospital is they go to the supermarket and they take the blood pressure of the patient, or like the people in the supermarket. And if someone has a high blood pressure, so they let them know that they have to keep an eye on their blood pressure. So that's something that was there. So that could be included as a volunteering experience. Everyone has other things they have done in their life. So that could be always added, okay? And then the CPD courses. So we will remove this one. So CPD, so I have done the emergency focus course in 2023. So I put AMC MCQ emergency focus ATCPD, and then which city I have done that, and then any other CPDs that you have. So in here, I would add all the ALS BLS and all of that you have guys here as well. If you have that, I also, before getting my job, I have done an IV cannulation session workshop, which was in Melbourne. And yeah, so I added that in my here. I know a lot of people will ask, do you have any specific courses to make our chances of getting a job? So there are not specific courses, to be honest. It's more how your CV looks like. A CV that neat, that well, like planned, depends also on your clinical experience. If your job is nice, it's you like, I mean, and you show it in a good way and you show it in a very clear way, you get higher chances of getting a job. But also people need to, you have to, there is also big components of luck, right? So you have to be lucky for your CV to get shortlisted. If your CV shortlisted, that's a very good point where they can see your CV. Not all the CVs get reviewed, right? So you just want to make sure that if you are lucky to get your CV shortlisted, at least they have a good CV to look at, right? So I'm going to remove this. And then guys, if you have any other things that you have done, so if you have like research, you can add a research. You can add a research box here as well. Yes, and I forgot one box as well that I'm gonna add it now. So you have to add a research box if you have done research. If not, you just don't add it. And then, so after the clinical experience, so you have, let's start from the beginning. And another thing that I want you to make sure is make sure that your lines are aligned from here. So this done, qualifications are done, registrations are done, job has to appear in the first page. I say it again and again, the job has to be in the first page. And then we will move. So here you can always add electives and observerships after the job, electives and observerships. So, and then you can just copy the same box from the job, a similar box. So let's copy this box here. And for example, I did an elective in the UK. So I will just put the date that was done in 2022, and I will just say an observer, or I was a medical student then. You can just remove the full time here. And then we will do, sorry, again, I always forget about removing this. Yeah. And then what we will do here, so what I like to do in elective and observership is to put achievements. Right? So what did you achieve? So I would just say learning how to document proper word round plans, for example. Assisting in surgical procedures. What else did you learn? Practicing communication skills in an English speaking setting. And then you put the country, so where I did was the UK, and then the contact detail. So that's something that could come here. And then after the electives and the observership, we have one more thing that has to come here as well, which is clinical skills. Clinical skills. So we do it a table, and we do what we are competent in and what we have observed. So I will put here competent and observed. So I guess everyone is competent. So things like IV cannulation, venopuncture, airway management with nasal prongs, and mask. If you have done anything else, just make sure you just add it. But you can also say basic life support here. And anything that you have interpreting, I don't know, could be anything, interpreting X-rays and ECGs. So that will be. And then observed, so mainly for junior doctors, no one is expected to do, for example, intubation. Not all the junior doctors are expected to know how to do, for example, a lumbar puncture. I don't know. And then you can add anything here as well that you have observed, but you are not competent in doing. So here you can add as competence. So simple sutures, that's what I'm thinking, catheterization, NG tube placement, and yeah, lumbar puncture, intubation, advanced leg support. If you haven't done an ALS, you can add it here. What else you can do? So you have surgical procedures that you have observed, but you have not never done any of them. What else? So reduction of complex fracture. There is no shame in saying things that you don't know, but you have observed. Complex fracture, and so on. So for example, I have never done pediatrics catheterization. So that I mentioned it in my CV and that was fine. So that will be, let's remove this one from here. 1 second, guys. Delete cells and yeah, then presentation teaching, you also have your research. So for research, same, you can use the same table here. And you can just put the date and your research. It doesn't have to be a published research. If you have done any research in your uni or in your parts of your work, or you have done an audit as well, you can add it research and audit. You do the CPD hours and then the references. You need 3 referees with their information. So I want you to have and then you just verify your statement. You put your name. So you need 3 referees. They have to be the most recent one within the past 12 months or any one of your choice. Just put the most recent ones. And of course, you have to delete this once you do that. So it has to be a consultant level or a senior registrar level. So you put name, position, department, email, and phone number. This has to be from your home country, of course, if you're not already working in Australia. And then name, signature, and date. So that will be all. The idea is to keep it as simple as possible, as short as possible, maximum 3 pages. And that's how I did my CV. And I really think it's really overwhelming to see a 6-page CV, a 7-page CV. If you have so much experience, you can try to make it in 4 pages maximum, not more than that. And just keep it simple, keep it nice, keep it clean, keep it organized, a simple pattern, same pattern, no mistakes. Of course, all these mistakes have to be gone and to be corrected, and this doesn't have to be in bold either. So yeah, so just correct the mistakes. You can use the help of ChatGPT in correcting your mistakes, but don't let ChatGPT write your whole thing. If you want to tell GPT to write it, make sure they write it simple, professional, but not overcomplicated, because they really know it's not you. So that will be the end of my video. I just tried to make it as short as possible so it's not overwhelming. I also tried to show you how I did my CV. This is exactly how I did my CV and how I got a job with this CV. Even though I did my best in my CV, I still got so many rejections. So rejections are always expected. Do not expect that you will get a job just because you did a great CV. No, it just takes a lot of time and consistency. And always keep improving your CV. If you see something that you could improve, write better. If you see a mistake, keep improving your CV, make it better, make it nicer. If you see that you have wrote something here that you don't like and want to change it, keep changing it. It's not an issue. The more you improve your CV, the better. And it's just a lack of getting your CV seen and getting shortlisted for the interview. So that is my first video ever, and maybe I will do a couple of video more, maybe just to cover how I did my cover letter as well, and how I prepared for my interview, which I think it's really, really important to get a job, to do a great interview. And for the cover letter, we will do it in a similar template. Like I will just put a blank worksheet and I will write a cover letter with you guys. So you can use the same template when writing your cover letters. And yes, I also want to make one video about how to apply for jobs. So I think everyone asks how to apply for jobs, where to apply for jobs. So I can actually show you how did they apply for jobs. And that's it. So for today, I just don't want to make it longer. Thank you so much for listening, and keep an eye on my channel. Just using it to upload a few videos. I'm not sure if I will keep using it in the future. I just want to use it for a couple of videos that will help you in starting your career after passing your AMC1 and applying for jobs and getting into the system. And I'm happy to reply to any doubt or issues that you have in the comment section. So just drop a comment, subscribe if you want to subscribe. I really don't care about the subscribers at the moment. So just feel free to just see the video. If it is interesting, great. If it's not, feel free to seek advice and ask someone who's more professional. I'm not at all a professional CV writer. This is just my experience, how I did my CV myself and how did it work for me. And I know my colleagues who followed a little bit my templates or these templates, they actually got a job as well. So I'm just here to offer some help if someone can do it. If someone has more resources and they want to go for more professional help, pay more things and more courses for a CV, that's great for them as well. There is always a learning point in joining courses. But if you want to start simple, I think this video will be a great start. Thank you so much and goodbye. See you in the next session.